Next slide. Blood supply of the suprarenal gland. Okay. Next is the medial border and the lateral border of the left suprarenal gland. So here the medial border and the lateral border of the left suprarenal gland. So the medial border of the left suprarenal gland is related with the left inferior phrenic artery, okay, and the left gastric artery and the celiac ganglia. Okay, medial border of the left suprarenal gland, whereas the lateral border it is related with the kidney. Okay, so this is about the relations of both right and the left suprarenal gland. Okay. Next is about the structure of the suprarenal gland. So on cut section it is showing the outer cortex and the inner medulla, isn't it? So in the cortex there are three layers, isn't it? Zona glomerulosa, zona fasciculata and reticularis. So this is about the histology. So grossly just I am telling, okay, about the structure of the suprarenal. Zona glomerulosa, cells in this layer, these are the, so this is the picture of the microscopic picture of the suprarenal gland, is that it? So this is a capsule and this area glomerulosa and fasciculata, reticularis and inner one, this is a medulla, is that it? So the glomerulosa, so cells in this layer, these are the columnar cells arranged in the curved columns. So what are the hormones secreted by this layer? It is the adrenocorticoids, isn't it? So what are the functions? Life saving, increase the absorption of sodium and increase the blood pressure. Zona fasciculata, cells present in this layer, that is polyhedral cells arranged in the straight cords of the two cell thing, isn't it? And what are the functions of this layer, that is fasciculata? The life protecting hormone, glucocorticoids, okay, and provides resistance to stress and inflammatory and immunosuppressive, isn't it? And this is about the fasciculata. Just briefly I am covering. Okay, so this is supposed to be taught in the histology, isn't it? So, yes, no problem. Huh? Just for your refresh of the knowledge. And reticularis, in reticularis layer, the cells in this layer, that is the round cells arranged in the branching cords, isn't it? So here, cells of reticularis, isn't it? And the hormone secreted by this layer, that is the catecholamines, that is the adrenal, noradrenaline and the dopamine. The functions of this metabolic function, cardio acceleration, that is the vasoconstriction and the neurotransmitter. So these are the functions of the medulla, isn't it? Next is the arterial supply of the suprarenal gland, isn't it? So this is the inferior vena cava, okay, and the abdominal aorta. Okay. So the on either side, right and left inferior phrenic artery. Okay. On either side, and so it is the branch of the inferior phrenic artery. So these are the branches from the inferior phrenic artery. These are the superior suprarenal artery. Okay, branches from the inferior phrenic artery. These are the superior suprarenal artery. Okay, and next is three sets of arteries supplying the suprarenal gland. Next is the middle suprarenal artery. Okay, and it is a branch from the abdominal aorta. So this is aorta, isn't it? So it is directly from the abdominal aorta, middle suprarenal artery. Okay, on either side. Next is the inferior suprarenal artery. So here the inferior suprarenal artery. So where it is giving the branch? Renal artery. Isn't it? On either side, figure 1, these are the left and right renal artery. Branch from here gives rise to the inferior suprarenal artery. Okay. So the blood supply of the suprarenal gland, it is by the 3 sets of arteries. Okay. Superior suprarenal, middle suprarenal, and the inferior suprarenal. Okay. So the superior suprarenal artery, it is a branch of the inferior phrenic artery. Isn't it? And middle suprarenal artery, it is branch from the abdominal aorta. Isn't it? And the inferior suprarenal artery, it is branch from the renal artery. Is it clear now? Yes. Next is about the venous drainage. So each gland, it is drained by only one vein, whereas arterial supply 3 arteries, isn't it? So the venous drainage, it is by the single vein from the each gland, isn't it? So the right suprarenal vein, see here, where is the right suprarenal vein? Here, blue color, isn't it? So the right suprarenal vein drains into, what is this? Inferior vena cava, isn't it? Drains into inferior vena cava. Whereas left suprarenal vein, where it drains in left renal vein. So this is right renal vein and the left renal vein, isn't it? From the abdominal aorta, left renal artery and the right renal artery. Similarly, this is the inferior vena cava, right renal vein and the left renal vein. Okay. So the left suprarenal vein drains into the left renal vein and the right suprarenal vein drains into the inferior vena cava.
What is the left renal artery?
Yes?
The left renal vein, what is it?
Just now I have shown. Left suprarenal vein drains into the left renal vein. Okay. And about the lymphatic drainage of the suprarenal gland, lymph from the both the suprarenal glands drains into the para-aortic group of lymph nodes. On either side of the aorta, abdominal aorta, there are the lymph nodes, isn't it? Para-aortic group of lymph nodes. Lymph from the suprarenal gland drains into the para-aortic group of lymph nodes. Okay. This is about the venous drainage and the lymphatic drainage of the suprarenal glands. Next is about the nerve supply of the suprarenal gland. The nerves are exceedingly numerous. Okay, and they are predominantly myelinated fibers, that is the preganglionic sympathetic fibers derived from the splanchnic nerve. Okay, and distributed mainly to the chromaffin cells of the medulla. Where the chromaffin cells are present? In the medulla, isn't it? And which are homologous to the postganglionic sympathetic neuron. Okay, and the activity of the cortex largely controlled by the adrenocorticotropic hormone, which is secreted by the anterior lobe of the pituitary. Okay. So this is the sympathetic trunk from T10 to L1. Okay, gives rise to splanchnic nerve here. Okay, preganglionic fiber. Okay, and these supplies to the medulla of the suprarenal gland. Okay, splanchnic nerve, preganglionic fibers. Okay, to the medulla, and the postganglionic nerve fibers from the celiac and the renal ganglia relays here, which supplies the blood vessels. Okay. Which supplies the blood vessels. Postganglionic fibers, and preganglionic, that is the splanchnic nerve from T10 to L1 supplies the medulla. Okay. Next is the accessory suprarenal gland. Accessory means extra. Extra, accessory. Apart from this, isn't it? So these are the okay. These are so in your objective. It is also one of the objective. Accessory suprarenal gland. So what are these? These are the small masses of cortical tissue, often found in the around the main glands. Okay. Around the main glands, and sometimes in the spermatic cord, epididymis, and the broad ligament of the uterus. So in this area there are the cortical masses present. Okay. So these are the accessory suprarenal gland. And next is about the developmental anomalies of suprarenal gland, that is the ectopic sites. So other than normal area. So normally it is above the upper pole of the each kidney, right and left, isn't it? So apart from this, may present in the spermatic cord instead of the kidney, isn't it? And may present in the broad ligament of the uterus, developmental anomaly. Okay. And in the epididymis, and in the gastrosplenic ligament, and the may be present in the greater omentum. Ectopic sites of the suprarenal gland. Instead of there, may be present here. Okay, ectopic sites, developmental anomaly. Next is congenital hyperplasia. Increase in cell count, hyperplasia, isn't it? So the excessive androgen secretion by the hyperplasia. So adrenal hyperplasia, it is the autosomal recessive disorder, and due to this increase in androgen level, there is a clitoral hypertrophy. Okay, clitoral hypertrophy may be there in case of congenital adrenal hyperplasia. Next is about the applied aspect, applied anatomy.
Can you repeat that?
Developmental anomalies of the suprarenal gland. Okay, that is ectopic sites. Okay, apart from the normal place, it may present in different locations in the body, isn't it? So ectopic sites we will call it as. That may be in the spermatic cord, that may be in the broad ligament of the uterus, maybe in the epididymis, maybe in the gastrosplenic ligament, and the greater omentum. These are the ectopic sites. Okay. Most probable location apart from the normal developmental anomaly. Spermatic cord. Epididymis. So in the testis, upper part of the testis, it is having the epididymis. Then it becomes the ductus deferens. Okay, spermatic cord. It goes like this. Instead of there, the epididymis. Is it?
So this what about the patient with this problem? Should be removed or take some medicine?
No, small only, surgical removal. Is it? And next is applied anatomy, that is in the adrenal cortex, the hypoactivity of the adrenal cortex leads to Addison's disease, okay, and Addisonian crisis. Maybe it is covered in the pathology. Is it? Yes. And hyperactivity of the adrenal cortex leads to Cushing syndrome, adrenogenital syndrome, and the and the stereonicum, isn't it? And the adrenal medulla, about the adrenal medulla, pheochromocytoma, tumor in the medulla, isn't it? Pheochromocytoma. Addison's disease, these are the causes, okay. And the signs and symptoms of the Addison's disease: pigmentation of the skin, okay, dehydration, muscular weakness, isn't it? And the hypotension and Cushing syndrome. So the causes are the hypersecretion of the glucocorticoids, okay, and tumor in the zona fasciculata, and tumor in the pituitary gland, and hypothalamic disorders. And what are the signs and symptoms? The moon face, buffalo hump, pot belly, okay, and thinning of the skin, thinning of the extremities, okay, and the poor wound healing, the Cushing syndrome, isn't it? And adrenogenital syndrome. So these are the causes, okay, and the signs and symptoms in the female: muscularization, okay, enlargement of the clitoris, and male type of hair growth all over the body, isn't it? And the deepening of the voice, harshness of the voice like a male, isn't it? So in case of male, feminization, okay, instead of male he behaves like a female, isn't it? Feminization, gynecomastia, and hypertrophy of the testes. So this is about the adrenogenital syndrome. Next is pheochromocytoma. So what are the causes? Yes, tumors of the chromatin cells, the tumor of the sympathetic ganglion, the signs and symptoms: severe hypertension, okay, and the anxiety, epigastric pain, and the adrenergic sweating, and polyuria with increased excretion of the colamides. Okay. So this is about the pheochromocytoma. So this is about the applied anatomy, applied aspect of the suprarenal gland. So this completes a lecture on the suprarenal gland. So
What about the seeds?
just to explain, isn't it? So in the anatomy part, be concentrate or be familiar with the blood supply, nerve supply, location, about the measurement, isn't it? And shape of the gland.
So it should be
Yes. 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 Yes.